exercises can I do after having a C-section? That's what we're diving into in today's third video in the Exercise After C-Section series. Welcome to the Strong Mom channel with fitness and nutrition for strong moms like you. So if you are a new mom or a soon-to-be mom, please make sure to hit subscribe and hit the bell so you never miss a video from me. Did you know that there is one exercise that you can do right after having a C-section surgery? And no, I'm not talking about crunches or planks, and I'm definitely not talking about this kind of stuff that you see on YouTube claiming that moms after C-section can lose their belly fat by doing the plow pose. Are you kidding me? This stuff should be illegal. And don't even get me started on the computer-generated woman doing the exercise. So if you're here to learn a legit core exercise from a real human being, then keep watching because I am a personal trainer specialized in only helping moms rehabilitate and retrain their core muscles after having a baby and C-section surgery. In my last video in this series, I talked about a gentle restorative breathing exercise that you can do right after having your surgery. In today's video, we're going into a step further. We are talking about rehabilitating, re-strengthening, and retraining our deepest core muscles and our pelvic floor muscles so that we can heal, so that we can feel our core working, so that we can stabilize ourselves, so that we're not feeling mushy or hollow or wonder where our abs went after having our surgery. And this exercise you can do even before your doctor has given you the all clear. So here's where we're gonna start. We're gonna come on down to the ground, but if you are immediate postpartum and spending lots of time in bed, that's cool. You can do this in bed as well. So the rest of us will be on the ground. The exercise is that gentle that doing it from the comfort of your bed is a perfect position as well. So what we're gonna be doing today is working our whole deep core muscle system. And I know most of us will think, oh, our core, that is our abs, our six pack, our rectus abdominis muscles. No. Our core is so many more muscles than just those recti muscles. So when I talk about our core, we're gonna work our whole system, and there's multiple component parts of it, but we're working our diaphragm. So remember last week when we were doing our restorative breathing, we were working our diaphragm. We are also contracting our pelvic floor muscles. We are also working our deepest core muscle, which is like this, it's almost like a corset that wraps around our whole abdomen, and that's called our transverse abdominis. And we're working down some muscles down our back that go down either side of our spine called the multifidus muscles. So this is our whole core. So basically our core is from up here to down here. So that's what you can think of now when we talk about core, okay? Not just abs, just your whole up in around here. So where I want to start is we're gonna come down and just come onto our backs. And the first thing I want you to do is I want you to take your fingertips and just feel where your hip bones are. And then I want you to come in medial to that. So hip bone and just slightly like an inch inward towards your belly button. And I just want you to kind of hang out here with your fingers for a minute. And I want you to just cough gently. Maybe you can feel a little, maybe you could see that. When I coughed, a little kind of bulginess happening there, a little kind of tension. That's what I want to feel. All right, so what I want to keep my fingers there. And what I want you to do is think about last week's breathing exercise. Remember, we inhaled, expanded in through our whole rib cage. And on the exhale, I want you to breathe out as if you were blowing candles on a cake, okay? So candle breath. Fingers here, inside that like, kind of squishy little area. I want you to inhale here. Exhale candles. Again. Exhale candles. Now I want you to be feeling some tension here. When you exhale, I don't want you to be like, I don't want to feel bulginess here. I don't want things to be popping up. I want to feel gentle tension happening right in here, okay? So that's your transverse abdominis, the lower transverse abdominis working. Now, what we're gonna do is add on a Kegel. Yes, a Kegel, otherwise I call it a pelvic floor contraction. So if you don't know what a Kegel is, the best way to describe and for you to try this is while you are on the toilet urinating, I want you to stop the flow of urine midstream. If you can do that, that is exactly the muscles that we're talking about. Those are your pelvic floor muscles. Now you're only gonna do this once because if you keep stopping the pee midstream, that can lead to infections, and we don't want any infections down there. So that is the muscles, those are the muscles that we are working. Now, a lot of us do Kegels incorrectly. And what we're actually doing is just squeezing our vagina muscle so tight. And we don't want that because our vajayjay muscles are just like any other muscles in our body. They need to relax and contract, right? Like squeezing isn't gonna make it any more strong. It's actually gonna make it weaker. So we want to contract our pelvic floor muscles properly. And how you're gonna do that is get out of your mind, you need to squeeze. And I want you to think about lifting up. So when you are doing your Kegels, you are not squeezing, you are lifting up. And this is what I call picking up blueberries with your vagina. Yes, I want you to imagine that you are picking up a blueberry with your vagina and pulling it all the way up an elevator shaft. And that is a very good cue for you, visual cue, for you to think about when you are doing your Kegels and your pelvic floor contraction, AKA blueberry breath. So let's get into it. All right, so now what we're gonna do is add on our pelvic floor contraction. So remember, we're not just squeezing and holding that pelvic floor muscle. We are imagining a whole kind of lifting up all the way up, and then we're relaxing all the way down. Remember the blueberry. So what we're gonna do is we're gonna inhale, expand ribs again. On the exhale, you're going to candle breath, but also you're gonna pull up that blueberry nice up that elevator shaft, and then you're gonna relax it. Okay, I know there's a lot of moving parts here. I will cue you. All right, inhale, expand rib cage. Exhale, candles, and pick up blueberry. Inhale, expand. Drop the blueberry all the way down, expand your breath. And exhale. Inhale, drop the blueberry all the way down, relax your pelvic floor, and exhale. So what you should be feeling, or what you may be feeling, is that tightening up down here. You will be feeling your vagina picking up that blueberry. But here's the thing, if you're not feeling it yet, it's okay. This takes practice and it takes coordination. You're exhaling at the same time as you're picking up a blueberry, then you have to release it and breathe. It's hard. I know this is not easy. It's like a total coordination. So that's why last week we started with the breath. This week you're adding in that contraction with the breathing. Okay, so what we're gonna do next is we're gonna go through that again, 10 reps, and do what you can, okay? All right, are you ready? Inhale, expand. Exhale. Inhale, release blueberry all the way down. And exhale. Inhale, release blueberry all the way down, expand your rib cage. Exhale, pick up blueberry all the way up, candle breath, candle breath, candle breath. Inhale. Exhale, pull blueberry up. Inhale down. You can place your fingertips here so you can feel maybe that contraction on the next couple reps. Inhale, expand. Exhale, blueberry. Inhale, expand. Exhale. Inhale, drop the blueberry all the way down. And exhale. And release. Okay, so the transverse abdominis, this contraction here where you're feeling a little bit of tension, you don't want to feel any bulgy. So you don't want to feel like the muscle like boop, popping out and really like poking you, okay? It's just a tight little tension here that you want to feel. And what I always like to tactilely kind of do too is, well, if you are a really immediate postpartum, you're not gonna wanna be tapping down here after your surgery, so don't do that, but at least you're still working your deep core, you're still working your pelvic floor, and all this whole core that needs to be retrained. But maybe you're saying, but Denise, I had a C-section. I did not have a vaginal birth. I thought pelvic floor exercises were for moms who birthed the baby out of their vajayjay. Nope. You still carried a baby for 9 months. You had all that pressure of your baby pushing down on your pelvic floor muscles. And maybe you've even spent time in the pushing phase of labor before your C-section surgery. I'm not saying your core muscles are shot. I am saying that you need to retrain and re-strengthen those muscles to work in coordination together so that you can go back to exercise, so that you can go back and do those things you want to do free of back pain, free of leaking pee when you jump or sneeze, and get a flatter belly after baby. So now you know exactly how to re-strengthen your core and your pelvic floor even before your doctor has given you the all clear to exercise. In the next video, we'll be doing a workout. It is your first body weight workout after getting the all clear, the green light from your doctor, from your surgeon to go back to exercise. So make sure to hit subscribe and hit the bell so you don't miss that video. If you like this video, please, you know what to do. Give me a thumbs up. Please comment below. Stop by. Tell me what videos you want to see next and how can I help you on your working out after having a C-section journey. I'll see you in the next video.